Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Yuri Han. Thank you for joining us. Tonight, we take a look back at stories from our health team, from efforts to keep marijuana edibles out of the hands of kids to making cochlear implants more affordable.
Arizona Poison Control says they get calls every day from parents who say their child accidentally ate edible marijuana. Cronkite News reporter Ariana Ariza looks at the partnership working to keep what looks like regular candy out of the hands of children.
Of the 739 cannabis-related calls to the Arizona Poison Centers last year, more than half involved children. A new effort hopes to bring those numbers down.
Poison Center, this is Kim.
Phones ring in the Poison Control Center at Banner Health. At the other end of the line, parents concerned about their child's safety. More and more, medical experts say cannabis edibles that are safe for adults are sending some children to the hospital.
In fact, in an adult, we see similar symptoms in kids of drowsiness, incoordination when walking. They could be giggling or just kind of acting inappropriately, all the way to the point where they're so drowsy that they can't be awakened, or that their breathing pattern is slower than normal, or in the most rare and serious circumstance, they can develop seizures.
Maureen Rowland of Banner Health says poison centers in Phoenix and Tucson handle calls mostly from parents of children younger than 5.
Usually it's 2-year-olds. So 2-year-olds are very curious. They put everything in their mouths pretty much. So that's one of our biggest messaging is that if you do have these products in your home, they are a drug, they are a medication, so you need to treat them as such.
Ann Torres of the Arizona Dispensaries Association says edibles are supposed to be in child-resistant packages. And she says state law prohibits the sale of edibles that might attract kids.
There's no gummy bears, gummy worms at all in the adult use market in Arizona. So if you see that type of product, you know it's coming from an illegal or an unregulated product.
Of the 394 pediatric cases involving cannabis last year, 60% required a hospital visit. Arizona Poison Centers is working with the Arizona Dispensaries Association to help educate parents on safe cannabis use.
Member dispensaries will have a window cling that will identify that they are members of the association. That allows consumers to scan a QR code, which will go back to the association website. It has information on safe consumption and what to do if there's accidental ingestion.
Leaving marijuana edibles around kids gives them easy access to eat the products. Parents are advised to lock them up and keep them out of reach of children. In the newsroom, Ariana Ariza, Cronkite News.
Since the pandemic, there have been a number of shortages impacting Americans, from toilet paper to eggs, and now medication. Cronkite News reporter Shira Tanzer shows us how a lack of ADHD medication is impacting people's health.
ADHD is one of the most common mental disorders in children, and now people are finding it hard to get a hold of the medication that experts say can change the way they live. In October of 2022, the FDA announced a shortage of ADHD medications such as Adderall. Without access to these medicines, patients with ADHD are forced to go about their lives without the help they would usually be getting.
This disorder, it affects all aspects of someone's life. It affects socially, their family relationships, intimate relationships, work, school, and it doesn't take a break.
Geddick, an ADHD specialist, explains ADHD medications send neurotransmitters to the prefrontal cortex of the brain, allowing patients to organize better and control impulsive thoughts. Nurse practitioner Benjamin Sparks says these behaviors come out differently in every patient's life.
It's not just the classroom, it's not just work, it's home, and it's those interpersonal relationships.
According to the CDC, 8.2% of Arizona children are diagnosed with ADHD. Kalmash Gandhi with the Arizona State Board of Pharmacy says one option for those looking for medication is compounding pharmacies, where they produce medicine on the individual level.
According to the FDA, if there's a documented shortage of medications, then compounding pharmacies are able to compound these medications.
Geddick says a lot of pharmacies such as Walgreens and CVS get their prescriptions from the same supplier. So if the suppliers run out, the medication can't get to the patients.
We have a lot of new clients that are coming here who weren't able to get medicine from other practices that they were going to. But with our clients, our staff, we call around when we work with pharmacies, local pharmacies, we call around every day. So our clients aren't going without medicine.
There's no update on when these medications will become available again. If you're unable to get ADHD medication, try calling different pharmacies in the area before turning to compound pharmacies. Reporting in Phoenix, Shira Tanzer, Cronkite News.
Every year, hundreds of people in the U.S. die during pregnancy or just after. Yet experts note the vast majority of these deaths are preventable. In Arizona, there's a push to expand access to certified doulas to help combat these deaths, particularly among individuals of color. I took a look at what's being done to make these services more widely available.
You're not hired by the hospital, you're hired by that family. You solely work for them. And that's something that's really unique about the doula-client relationship.
Doulas don't deliver babies, but they do offer important help throughout the birth process, from educating clients about what to expect to developing a birthing plan. More importantly, they provide patients with much-needed support, comfort, and advocacy.
Doulas are kind of helping to bridge that gap in communicating with your provider.
Letisa Ratliff has been a doula since 2017 and is part of a new advisory committee in Arizona. The group is exploring how the state might certify doulas, a first step toward getting these services covered under Medicaid.
I think that with Medicaid covering services, it will give more families the accessibility to doula care.
Nationally, Black women are 3 times more likely to die from a pregnancy-related cause than white women. In Arizona, women of color are also more at risk. For this reason, Stephanie Moore of Ahwatukee hired Ratliff to be her doula.
For me, it was really imperative that if I'm going to have someone advocate for me and I'm going to have people in the room, that they're going to be people who are people of color.
Research shows that having a doula can lead to better birth outcomes, including fewer C-sections and improved mental health. But the cost and a lack of knowledge around what doulas do are barriers for some.
We do our best to have sliding scales, to have payment plans in place.
The advisory committee is also working to identify training for doulas that includes culturally relevant practices.
We're all having babies. We all, deserve to have a voice and have representation from the top to the bottom.
Despite the growing demand for doulas, experts stress that the crisis surrounding Black maternal mortality is a complicated issue needing complex solutions.
Hello, I'm Adrienne Farewell, General Manager of Arizona PBS. We've got so much going on here at the station.
I'm Catherine Anaya.
I'm Alberto Rios.
I'm Chef Mark Tarbell.
I'm Ted Simons.
We want everyone to know that their Arizona connection starts right here at Arizona PBS.
For over the past 60 years, Arizona PBS has told incredible stories of Arizona's distinctive people.
We got to start being more vulnerable with each other.
What I love most about being a Latina woman is the passion and drive that I feel.
Beautiful landscapes and treasured history.
We're doing something that benefits the community.
Good evening and welcome to Horizonte.
Welcome to Check Please Arizona.
Welcome to the U.S. Senate debate.
The recipient of the Emmy is
Arizona PBS.
Now on Passport.
What are you looking for in your life?
There's an important story that needs to be told.
Is it a sense of your own destiny?
Choose your story.
Try to help create change in some way.
It's a beautiful thing. Not very many people get to see.
Once you come into the neighborhood, you are a part of the family.
You can be a good person or a bad person. It's your choice.
Stop complaining and go actually do something.
Now you can stream even more documentaries with Passport on the PBS Video app.
Hello, I'm Adrienne Farewell, and I'm proud to serve as General Manager of Arizona PBS. From Phoenix to the Grand Canyon, Flagstaff to Prescott, and everywhere in between, this station is the best way to remain connected to all that's going on in our beautiful state. So whether you're interested in arts, culture, and music, to local politics and education, we've got you covered. You're watching Arizona PBS, and your Arizona connection starts right here.
Boys and Girls Clubs of the Valley provide thousands of young people a home away from home. Kids participate in sports, have a place to go after school, and now will get help related to mental and behavioral health.
Cronkite News health reporter Jordan Lavazari tells us about a new collaboration between the organization and Teros Health.
The new Whole Child Approach program will bring behavioral health coaches to 10 different Boys and Girls Club locations. The goal of this partnership is to assess the mental health of the kids who attend, using games and everyday activities to help them open up and develop more resilience.
15-year-old Aldo Cano has been coming to the Boys and Girls Club in North Phoenix since the first grade. He was named 2022 Youth of the Year for the branch, but he wasn't always this outgoing.
I was back then a shy kid. I didn't want to be near anybody. Most of the time, I would go from school to home and not talk with anybody. But after my mom put me in the club, it was really helpful, especially since the first activity I joined was soccer.
Things took a turn for the worse when the pandemic struck. Though the club remained open, Cano's parents felt it was safer for him to stop going for a while.
I instead went to go work with my parents for 4 months, and during that time I'm still doing school. But it was a bit harder for me since I wasn't able to catch up with anyone, since I don't have a phone, so I was totally isolated.
The pandemic had devastating consequences for the mental health of many Americans, but its effects were particularly tough on youth. To help, Boys and Girls Clubs of the Valley is partnering with Teros Health to embed behavioral health counselors on site at club locations.
So the whole child approach with the Boys and Girls Clubs will be to introduce social emotional learning within our programs that are already running within the club, give youth cognitive skills, behavioral skills, lifelong skills.
Teros Health will staff 10 club locations the first year of the program, but the goal is to eventually expand to all 30 locations.
We know that the pandemic had absolutely devastating impact on children and their social and emotional needs. So really this is to get those kids back to where they should be with their social skills, their coping skills, and really have an impact on their future.
Cano is excited for the program and emphasized that young people need extra help with COVID still prevalent.
While we may act okay and put a smile on our face, that sometimes deep down we just need somebody to reach out. And I think that would make a huge difference.
Program leaders hope to expand this effort to all Boys and Girls Clubs of the Valley by 2025. In the newsroom, Jordan Lavazari, Cronkite News.
Second annual Black Men's Brain Health Conference is this week. Partners in the community gather to raise awareness about brain science research among Black men. They address brain health, cognitive aging, and Alzheimer's disease. Mayo Clinic was invited to help the community understand how the hospital is working to reduce health outcomes in minority communities. Director of Community Engagement, Marion Kelly, discusses health disparities facing minority populations.
I would bet, if I were a betting man, that 95% of them had nothing to do with DNA, have nothing to do with biology, but have more to do with social determinants of health. Some of those social determinants of health are access to care.
In Arizona, 5% of Black people are uninsured and nearly 10% of Black Americans are uninsured nationwide, according to a Quote Wizard report this month.
It's that time of year when more people visit the doctor for things like the flu or COVID-19. Cronkite News reporter Shira Tanzer shows us a new kind of test, making it easier for people to get treatment faster.
You may think that flu and RSV are long behind us, but the viruses are still floating around, and COVID may be a reason why numbers were so high this year.
When we started the pandemic, obviously we had a lot of people, staying at home, not going to school, kind of isolating, wearing their masks, and that kind of slowed down the transmission of the common viruses, and we ended up with a population of patients who are non-immune to some of those viruses that we're seeing now.
Dr. Balan with Phoenix Children's Hospital says the chances of transmission are now higher because of the lack of immunity, and that was reflected in this year's numbers. According to the Arizona Department of Health Services, more than 32,000 flu cases were reported in the state this year, with more than 17,000 in Maricopa County alone. At its peak in November, RSV cases were more than 20 times the amount from previous years.
Their symptoms are so very similar and the treatments are different. And so it is very important to get treatment started as quickly as possible because delays could actually affect how the treatments work.
Sonora Quest Laboratories recently started providing 3-with-1 testing, which takes one sample in the form of a nose swab and tests it for RSV, flu, and COVID. White says testing used to be through process of elimination, but the new PCR test separates the sample and tests it separately for all 3 viruses.
And this is a highly sensitive molecular PCR test that can detect influenza, RSV, as well as COVID from one specimen.
Cases in Maricopa County have been trending downwards, and both White and Ballon say getting tested can make sure they stay that way. In Phoenix, Shira Tanzer, Cronkite News.
The new 3-in-1 testing is available through your healthcare provider.
And doctors say the tests help people get a head start getting the treatment they need to feel better.
I'm Chef Mark Tarbell. Welcome to Check Please Arizona. You picked this place. Tell us why.
It was just so cozy.
Anything you order there is going to be phenomenal.
I had the meatballs.
Garlicky in the absolute best way.
They were amazeballs.
I was that person that went up to the salsa bar 4 times.
Not what I was expecting. Join me for the 10th season of Check Please Arizona. I'm getting hungry.
My heart is racing right now.
Fasten your seatbelt.
You're uncovering the truth.
These are consequential things. Yeah.
Oh, look at everybody.
I feel the presence of all these people.
I've got history.
No.
I wish my mom could be here to see this.
Amazing.
It's like the most vital stuff, right?
Tuesdays on Arizona PBS.
What you get from Washington Week that you will not get anywhere else are the best and the brightest reporters from different media companies, and they're able to have a real conversation. How do you think that so that people understand how power and politics impact their daily lives?
Friday nights at 7 on Arizona PBS.
With over 67,000 people gathered in State Farm Stadium to watch Super Bowl 57 earlier this month, some major health concerns for area hospitals arose.
Rachel Fortunato takes a closer look at what health troubles are still crowding waiting rooms.
When thousands of people gather together in one spot for a giant party, this caused massive concerns for healthcare providers. I spoke to Dr. Ricardo Carrera about the 3 most common injuries.
Traumatic injuries that can happen. The second part of this is injuries related to alcohol drink. And the third injury is because of the increased amount of excitement. Then there is the psychiatrist or mental health problems, anxiety, panic attacks.
Another big concern was the increased number of cardiac events. Dr. Michael White warned against many activities that go along with the festivities of sporting events, especially for people with existing concerns. In a statement, Dr. White said, "Those who are most vulnerable include people who smoke, have high blood pressure and high cholesterol, are diabetic, or physically inactive." Even though the festivities are over, hospitals are still seeing an influx in patients due to late onset infections.
Respiratory infection, that will take a little bit longer after that. It's not the same day. And it will be difficult to quantify specifically what happened on that in Phoenix, because many people are travelers. So they come, there will be some contamination of respiratory infections. Definitely is a place where everybody will be compact. That spreading of any viral infection of the upper respiratory system can happen frequently.
This season alone in Arizona, there has been over 32,000 confirmed cases of influenza. That number tripled from last year's cases of only over 5,000. RSV is also on the rise with over 15,000 confirmed cases this season. According to experts, hospitals will see patients affected by these respiratory diseases for the next coming weeks all across the country. In Phoenix, Rachel Fortunato, Cronkite News.
Welcome back to Cronkite News. I'm Diana Quintero. Though the national 5-year survival rate has risen from 21 to 25%, Arizona lags by 1 percentage point, according to the 2022 State of Lung Cancer Report. The report also indicates that people of color who are diagnosed with lung cancer face worse outcomes compared to other communities. Cronkite News reporter Jimena Vera tells us why.
Lung cancer remains the deadliest cancer, and experts estimate more than 5,000 Arizonans will be diagnosed with this disease this year. The lung cancer report shows that only 2.2% of Arizona residents who are eligible have been screened for lung cancer. Today, nonprofit Unlimited Potential conducted a health fair to educate the South Phoenix community about prevention, including smoking.
We have to wait until we have a diagnosis. We are together creating this culture of health, so we don't have to really go into the other step of being really sick.
The American Lung Association's lung cancer report released this week highlights the toll of lung cancer in Arizona and examines key indicators, including new cases, survival rate, early diagnosis, and screening rates.
We want to talk about that screening really is the key to reducing lung cancer burden in the state in Arizona.
The report shows Arizona as position 44 for lung cancer screening and 49 for lack of treatment. The report also highlights that people of color who are diagnosed with lung cancer face worse outcomes compared to white Americans, including a lower survival rate, less likely to be diagnosed early, less likely to receive surgical treatment, and more likely not to receive treatment.
We create awareness, we talk about different types of cancer, we motivate and empower our community through that education.
In Arizona, Asian Americans are the least likely to be diagnosed with lung cancer early. In the newsroom, Jimena Vera, Cronkite News.
Every 19 minutes, at least one child in the United States is exposed to drugs like opioids in the womb. It's a condition known as neonatal abstinence syndrome, or NAS.
Cronkite News reporter Laura Bargfeld has the story of a special nursery that is helping babies and their families heal.
Our families already feel guilty. They're already ashamed and hopeless. So many times once I come in and I talk with them, they're like, oh, I'm finally here. It's finally okay. We are a nonprofit serving moms, babies, and dads that struggle with opioid use disorder, babies that are exposed to the opiate while pregnant. And we have a nursery in Phoenix, it's 12 beds, where we help babies go through that withdrawal process a little bit easier with one-to-one caregivers, quiet, dark environment, and we're very trauma-informed and family-centered.
Hi, sweetheart. Okay. You're good.
What we found is that environment makes a difference. Babies respond better. Babies respond better to their moms and dads. Eat, Sleep, and Console is a way to assess what a baby needs that's going through the withdrawal process as far as treatment. So if they can eat an ounce, if they can sleep for an hour, and they can be consoled within 10 minutes, they don't need pharmacological support. So our peer supports, we have 3 peer supports right now, 2 moms and a dad, and they have been through the Hush-By program. So their babies were born substance exposed. And what they've been able to do here is help families that are in the exact same situation.
My name is Joey. I am a peer support specialist with Hush-By Nursery. I was in high school and, I played baseball. I kind of did everything. I played soccer as well, varsity, and I was hanging out with older people, and I started off, I got into, just partying, and it kind of went along the roads of, started with like Percocets and pills and stuff, and then I kind of got into black tar heroin. Over 10 years, I tried many times to get sober. But when I really realized, for me personally, that I needed to get sober was when I found out that my son's mother was pregnant. It was a lot internally to like compartmentalize everything and try to put the pieces together of the future, right? Like, what does the future look like is kind of how I thought about it. And then I kind of, what did I want the future to look like? The biggest thing that I did was get on methadone. I got some sort of treatment, right? And then I met Tara by total coincidence at the methadone clinic. Tara definitely helped guide that journey for me, if that makes sense. Like Hushabye and that program, had I not found it, I don't know what exactly would have happened. Thank you, sir. Having my son changed my life forever, personally. It's the greatest thing for me when I get to see a client overcome everything, get sober, come here after they deal with DCS, take their baby home, and then excel at being a parent, because that's what I did.
If it was your baby that was going through this, your niece or nephew or your grandbaby, you would demand them to be at Hushabye because the babies do better. And it is what they all deserve.
Since they opened in 2020, Hushabye Nursery has cared for more than 400 infants.
That's it for Cronkite News tonight. Thank you for joining us. For top Arizona news at any time, join us at cronkitenews.azpbs.org.